again, it's a very warm welcome. This is Anchor Neha Srivastav and I would like to welcome you all officially in this amazing day, which we're going to be one of the memorable one, and we're going to discuss about so many important topics as well. And everybody, this day is dedicated to health, as you all are here. And I know all the dignitaries are here, all the doctors, all the professors, all the amazing personalities are here in front of me, and I would like to share this beautiful stage with all of them, and we are very glad to have you all here. Thank you so much everyone giving your precious time to this beautiful day once again, and let's start this beautiful day. And everyone, I would like to brief you about the Global Healthcare Wellness Award and Conference 2023. This most awaited global platform is bringing eminent healthcare experts together from the health world to understand the health revolutions, market dynamics, the impact of digital technology on the masses, and the future of health and healthcare in India. The platform would also recognize and felicitate massive efforts of various health initiatives, healthcare professionals, hospitals, institutions, and initiatives benefiting India through a technology-enabled healthcare ecosystem. Hypedge Media, a premier insight-driven media, research, rating, PR, branding and marketing services company, has taken an initiative to organize healthcare awards. Globally, these awards are organized so as to recognize the efforts of doctors and healthcare or organizations in order to provide effective solutions for different served diseases. Global Healthcare and Wellness Awards and Conference are conferred on the outstanding highest achievers in international healthcare industry, research, management, pharma companies, health insurance companies, hospitals, and medical colleges, medical units. This is all about the Global Healthcare Wellness Awards and Conference, everybody. And now I would like to call all the beautiful awardees, whosoever want to introduce themselves, whosoever want to tell about themselves, they can come forward and share the stage with us, and they can brief about themselves, what they actually are doing, what is their name, and what business they are running. And if anything he or she wants to share, they can come on stage. It's an open stage.
And I am the key opinion leader for SFG Technologies. So today I'm here as a representative of HSG Technology. What we have done in last 4 years is this small piece. You can see it takes 4 years of hard work by a doctor and 3 engineering friends from IIT. So it was during beginning of the pandemic that we were free and we thought of doing something new. So one of my friend, Mr. Ramu Muthangi, who is an IIT engineer, he asked me, can we do something for blind people? And then we started doing work, what we can do. We came to know that in Israel, for last 6 months, they were doing some research on making glasses for blind persons. So we read their papers and it was in the initial stage. Then after 1.5 years, we could develop prototype 1, which was a bulky glass weighing 100 grams. And then again another 1.5 years. And now I would like to show you, these are the glasses in various functions. So these are the routine glasses. A blind person would wear it. There is an AI assisted module here, and it uses machine learning process also. It has 5 buttons. So if a blind person wears it, and presses the button number 1. This is for things around you. Suppose a blind person is sitting on this, standing on this stage, and he wears it, and thus just moves around his neck. It would speak out. It's a big hall, 50 to 100 people sitting. There's a cameraman, there is light. So it will identify objects in its vicinity. It can identify hundreds of objects, human beings also. So a blind person would know what is around him without asking other people's. Then second mode is reading mode. If a blind person holds a paper like this, it will take a photograph and read the whole page for him. And it can read in 72 languages. All Indian languages, even the local ones, Bhojpuri, Bengali, Assamese, all, Kashmiri, Urdu, Hindi, Arabic, all European language, Italian, French, German. So, you have to just choose the language. Then one of the problems with the blind persons is that they cannot recognize the currency notes. They just have to press that button and hold a note. It will say it's a 500 rupees note. So that's a very good help for them. Then there is walking assistant. So they just have to press button number 3, just tap on button number 3 and start walking. If there is any obstacle 2 meters or 3 steps ahead, it will say it's a stop. There is a wall in front of you 3 steps ahead, or there is a door, or there is a pole, or there is a person standing 3 steps ahead, and it will ask you to turn either right or left. Suppose there is an obstruction in front and on left also, it will tell, sir, you can walk only right. So take a turn towards right side. So this way it will help them in walking. Main problem with the blind persons is that when they walk, they hit objects every day. They say if you have to identify a blind person, don't look at their face, don't look at their eyes, just look at their shin, this part. You will find multiple injuries because every day they hit something. Even after taking help from the stick, still they hit objects. Second portion is they get injuries on the forehead. That is the part which is the leading part for them. So this invention has taken 4.5 years, but we are a very small organization. So people are not aware about this product. So my idea coming here and going to various conferences and podiums is that we want to spread awareness about this. In Israel, they took Lionel Messi, the famous footballer, as their brand ambassador. And in 3 months' time, they received as many orders as they couldn't fill in 1.5 years. Now Israel is on war, so they have stopped manufacturing these. India and US are the only 2 countries where these glasses are available. US has its own custom problems. So there are about 1.5 crore blind persons in India, about 8 crore in whole world. Help is there, but we have limited resources to spread the message. This audience also come here. Please connect with us, whichever way, as a volunteer. Send us whoever person cannot see properly. We will distribute these glasses. Price in India is 48,000 rupees we have kept. Israeli glasses, US glasses are available at 5.5 lakh rupees. 10 times, more than 10 times the price. But we have an NGO, third eye, which means people who don't have 2 eyes can live with this third eye. And see, we also, God has given us 2 eyes. We can gift this third eye to some blind person. So you can gift these eye to some blind person. You can take my contact us, send blind persons. We will give these classes to blind persons from zero amount to 48,000 rupees, depending upon that person's economic status. That is the only criteria. If we are convinced that they cannot buy it, we may take 1 rupee, we may take 10 rupees, 100, 500, 5,000, depending upon their economic status. I've been doing eye surgeries for last 35 years. I started my eye surgeries in 1986. I'm from Lama Azad Medical College, Delhi, LNJP Hospital, and all this life I have been doing surgeries, OPD patients, cataract surgeries, glaucoma. That was also very satisfying. But if you compare the last 4 years of my life, where I am doing this work, you cannot compare this. These 4 years are much, much better than those 30 years. That work people are doing. All my eye surgeon friends are doing this thing. But now we want at least, see, there are doctors, eye doctors for people with sight to give glasses, people with eye problems, you have doctors. There are no doctors for blind persons. That gap can be filled only when doctors join engineers. We know what is blind persons need, we know what they want. We cannot make these machines. So there has to be collaboration between engineers and doctors. And once that happens, we come out with this product, Smart Vision Glasses. Thank you, everyone.
Thank you very much, sir. Thank you very much. And that is so innovative idea, and that is a very good product, I would say. And the third eye is amazing. And now I would like to. That's my phone. You're taking my phone. I'm gonna come in between you, and I'm gonna ask you a few questions, and let's interact and.
Canada for Red Cliff Labs. So it's a diagnostic chain, and our reference laboratory is in Noida, but we've got around 80 labs all over India, in around 200 cities. So that's what it is.
Thank you very much for
Very good.
and introduce yourself.
I am Dr. Bhanu Pratap Singh from Bilaspur, Chhattisgarh. I am working as a director professor in the field of pathology since last 20 years, and my basic task is medical teaching as well as research also. So we are working in the field of diabetes researches. Thank you.
Thank you. Thank you very much, sir, for introducing yourself.
Hello everyone, I am Dr. Shakundrajit Kaur and I did my graduation from China Medical University. Currently I am preparing for abroad medical license exam.
Thank you so much, and you are giving us a Christmas vibe. Thank you so much for wearing that.
Especially near Rameshwaram. I am running my own counseling center known as ARA Counseling Center. I'm a consultant psychologist, psychotherapist and a skill trainer. And also, nowadays, even the literate people are also getting hesitate to have counseling because they are feeling like if they once attend a counseling center, others may symbolize them as a mentor. But that's totally wrong. On the other hand, some people don't have really time to have counseling, as well as they are really very much collapsed, and some of them are getting suicide also. That's why I found, and I do my own research, I have found 64 short courses. Even if people don't have time in their busy schedule, they can have my course even within a short break of coffee time, within 15 minutes. In a week, they can have within 15 minutes. In a week, a 5 working day, simply 5-15 minutes they are going to spend for me, not for me, for their problems, and they are going to found their life's golden keys. So I would like to promote this. Nowadays I am having my clients in abroad also. So this is my first time at Delhi. I'm really wondering how you are feeling the chillness. Because we are from so far. we can't even spend at least a minute without sweater. But I really wonder about your costume and really nice. Thank you, friends.
Thank you so much. And I would love to assist with you, and I would like to know that key points from you. Okay, nice to meet you, ma'am. You're looking lovely today. And here.
Myself, Prabhas Saxena. I am running my own company, Ishwar Healthcare. It's an asset-light model company, and we provide the ICU services at a very affordable cost. So recently, we had opened one center in Gurgaon, Vivekanand Arogya Kendra. In 6,000 rupees, we are giving the ICU facility, including duty doctor charges, nursing and consultant charges. And 9,000 rupees, we are giving the ventilator bed facility. So we are giving a very affordable costing pricing into the ICU segment, and we try to give a quality treatment with the low cost in entire Delhi NCR.
Very nice. That's so nice.
Thank you so much.
Thank you so much, sir. You're the center of attraction, I would say. Could you please tell us about your profession?
Basically, I'm an actual patient surgeon, and I'm coming from the Pune. There is one center is there. That is the 72 hour smile care center. That is it is related to dentistry. As we people know that to give a teeth to a person or missing teeth, you need an implant that takes minimum 3 months to 6 months. But we are using a strong bone in the body, and we are giving the teeth within the 72 hours. That's why we are giving the name of the 72 hours. So we can implant the teeth within the 72 hours for every patient, each and every patient. Thank you.
That's nice, that's nice. Nice to meet you, sir. Nice to meet you. I would like to welcome on stage Mr. Gaurav Gautam from Hypedge, everybody. With the round of applause, please welcome the organizer of Healthcare Summit 2023, Mr. Gaurav Gautam, as we reveal in the excitement of this extraordinary day, it's important to take a moment to recognize the driving force behind this spectacular event. The person we are about to welcome has not only envisioned this celebration, but has worked tirelessly to make it a reality. It is both a pleasure and a privilege to welcome the visionary leader and CEO of Hypedge Media, Mr. Gaurav Gautam. Everybody, can we have a huge round of applause? And everyone, now I would like to welcome our honorable dignitaries, and I request to Mr. Gaurav Gautam, sir, kindly please spell his state. Our guest of honor, Dr. B. Srinivas. Everyone, with the round of applause, please welcome on stage Dr. B. Srinivas, Deputy Director, General Medical Education, Ministry of Health, Government of India, guest of honor. I request to sir kindly please share.
New Age Awards, which is the Global Health Awards. It was actually a surprise for me because this came only 2 days back. I was expecting that we would be prepared for something related to medical education, because in the ministry I'm looking after the medical education, and as a medical education expert I was fortunate enough to start the NEET exam, and I see that a lot of the doctors are here. And our main vision and goal in the ministry under the Honorable HFM Mansukh Mandviya ji and our Honorable Prime Minister Modi ji is to create more doctors and more quality doctors for the future. So keeping that in mind, in the last 4 or 5 years, we have been able to increase the number of medical colleges across the country. We had around 300-400 medical colleges when we started, and now we have more than 700 medical colleges. Many of them are actually common medical colleges, and we have also started a scheme where we are concentrating more on the rural areas, and then we can produce more doctors and more aspirational districts across the country. So for that, we have made many efforts, and because as a doctor myself, I did my MBBS from UCMS and I did my MD from Maulana Azad Medical College. I think Mr. Joshi, Dr. Joshi is also from our college. That's nice to hear. And I feel a lot of many doctors, budding doctors, we want to train them to give them the best knowledge that is possible. And I think platforms like this give us the place where we can meet each other and we can facilitate each other. And if Joshi ji can, because we have different divisions in the ministry, we have our health, blind division also. There is a blind program that is running there. We can collaborate with them. Similarly, these platforms give us a place where we can interact with each other, network each other. And I thank Gautam ji that he has given us such a platform that we can interact and we can take a feedback. Since in the ministry we make the policies, but policies can be made if the feedback comes from doctors, patients and all the colleagues like you. And I think today will be a good platform for us to interact and give us the feedback so that we can put that into practice in the ministry and make a user-friendly policies. Thank you so much. Thank you.
SPM Dental College. Everyone with the round of applause once again, please welcome Shri Dr. Ramakrishna Shenoy-ji. On behalf of Hypedge, Mr. Gaurav Gautam, welcoming.
Wonderful Global Healthcare and Wellness Awards and Conference. I was very impressed by Dr. Rakesh Joshi with this invention. And I'm sure that this country needs more people like this, and that will go with the theme for better hospital care. Better hospital care is something that is very much needed in this country because there are so many people who are devoid of basic health access, and for that we need accessibility. The doctors who are trained properly. I am from the teaching profession as well. I have got a dual responsibility of being the vice dean, and my specialty is very close to the medical specialty, being a maxillofacial surgeon like Dr. Lakshman Malkuji from Pune. So what we aspire and what we wish to provide is that most affordable care, and that is the second thing that should come to the people. Having nice spanking hospitals with the latest of technologies, and whether the people would get access to it. That is something that's very important, and I'm sure that with people like Dr. Srinivas and other honorable doctors who are there, we should get together and put up something that is be affordable to everyone. I'm sure we can fill in our pockets with so many things that we can do, but it is the last mile delivery that is most important. So accessibility, affordability, training of the doctors, and of course compassion, that is something that's very important. We should not forget that we are there to treat the the poorest of the poor. And I'm sure, Gaurav-ji, this is known to all doctors, that we doctors do the maximum number of corporate social responsibility. We have free medical/dental checkups. We give so many patients, we give gratis. So this is something that goes with the nobility of the profession, and I'm sure we should keep it up and we should do our best. As far as the award is concerned, I am reminded of the words of the French soccer, the captain, the superstar, Zinedine Zidane. He said once that every award is special, every award is important, but the one that you're getting is the most special. Thank you for honoring me and inviting me. It was an equal surprise for me, to be present here as a guest of honor. I'm coming from Nagpur, and I would like to again thank the Hypedge media and Shri Gaurav for inviting me, and I'm sure that this conference is going to have something very productive. Thank you so much.
Thank you very much, sir. Thank you so very much for your kind and humble words. Chandigarh College of Pharmacy and Biotechnology. And here we have the director of Hypedge Icon Magazine, Mr. Gaurav Gautam, welcoming our honorable
management of this particular Hypedge media partners, who are, you see, organizers of this particular award function and conference. Obviously, these award function and conferences gives a platform for networking and exchanging the ideas. You see, now upcoming trends are changing a lot. Like last week, we were in the Governor House and Prime Minister Modi ji and Governor House conducted a lot of panel discussion regarding the Viksit Bharat. And the vision of the India is upcoming towards 2047, and it is expected that in 2047 it should be a developed India. So right now it is a developing stage. We are fifth economy in the world. Then also we are, you see, focusing on our government. The vision is focusing high, and that's a good for all of us, this generation, that we are expecting a lot of change. So obviously we all have to work in that particular directions. So healthcare is very important in addition to the others. As we come to the, you see, numbers, it is like 0.9 bed per 1,000 patients in India. So it's a, you see, alarming condition obviously, and the governing bodies, the regulatory bodies are working in that direction, as I just told, discussing that a lot of, you see, hospitals are upcoming. So healthcare is very important to be taken care in the budgets and in the upcoming policies. And my core field is cardiovascular pharmacology, so I am doing research in the stem cells and metabolic disorders, in addition to the work it is doing on the vascular. So I received grant from AACD, I received grant from ICMR, Indian Vascular Medical Research, for research. And my core area is like morphogens, which are like hedgehog morphogens are there, which are present in the newborns, and in embryonic, it is, you see, showing the growth. And it is responsible for the growth. So morphogens are there. So recently it has been discovered that these morphogens may be, you see, stimulated in the later stages also, so that the stem cells repair mechanism will be stimulated. So my core area is this, and obviously the giving from outside, there are a lot of challenges, and we know, and the physicians better know that this is a challenge. So we are working on the targets to stimulate the endogenous stem cells, and the hedgehog pathway is one of the pathways we are targeting. As an administrator, you see, I have a chance to be head of around 11 courses of healthcare. That is, you see, not of medical, but in addition to the healthcare is a big sector, having the pharma, B Pharm, M Pharm in multiple branches. Then PharmD is a doctor of pharmacy. Then I was also heading BSc Operation Theatre Technology, BSc Anesthesia Technology, BSc Radiology and Imaging Technology, then Physiotherapy Department, and BSc Biotechnology and Microbiology, and MLT also, BSc MLT. So I have a chance to, you see, opportunity to administer these departments. So, but the technically what the skills is demanded by the healthcare sector, that is a great challenge. And our national vision is focusing on that, but howsoever there is a great mismatch between the hospital industry and the academic institutes. Because obviously there is no time. Hospitals have a limited, you see, confidentiality issues, maybe limited challenges are there, a lot of challenges are there. So that's, you see, academics is okay, syllabuses are standardizing, and most of the UC councils are there, now the committees there, PCI, MCI, committees are there, Ministry of Health and Family Welfare is working in their direction. But how to come up with that mismatch? So that is a challenge. And doctors are okay, but the numbers are again limited. So this healthcare sector, other technicians who are exclusively to be skilled in that particular direction, they are not much getting the exposure in the hospitals. Again, if one radiology, BSc RT student is there, so 10 students cannot enter an X-ray center, X-ray room, and there is 100 intake. So how to make that challenge? So here all the physicians are there, policy makers are there. So my, you see, point of view is this always, the skill centers may be developed in the hospitals additionally, And in the industry, like I'm from the, you see, majorly pharmacology and pharma background. So in pharmaceutical industry, we are again doing this, that skill centers are developed. Our ecosystem is in right now, it is very favorable. Our funding agencies are very favorable. There are a lot of, you see, biomass projects, incubations are there, startups are there. A lot of schemes are there with the government. So that is, if it can be done, it will lead to the skill-trained, well-trained healthcare workers, and that will obviously maintain the gap between the patient and the physicians. So that is one of the points which I want to focus in this particular conference. So I congratulate the organizers, Mr. Gautam ji, and all the organizers who has organized this particular program. So my best wishes, and thank you for a patient hearing. Have a nice day. Thank you.
Thank you very much, sir. Thank you so very much. The director of Hypedge and iCan magazine, to felicitate our one of the guest of honor, and I would like to welcome him on stage, Shri Dr. Amrinder Singh, New Delhi, ex-RDA, Resident Doctor Association, President, AIMS, New Delhi. It's a lovely welcome, sir, in this beautiful function, in this beautiful event. And now I request to sir kindly please share a few words with us.
I done my Doctorate of Medicine from AIMS New Delhi in cardiovascular radiology and endovascular interventions. And I became the second Asian to do this Doctorate of Medicine from in cardiovascular radiology and endovascular interventions, and became the second Indian and first Punjabi to do this Doctorate of Medicine. So today's theme is basically patient-centric approach in healthcare system. So how we can make the life of every, you can say, patient very simple. So how we can do that? There are lots of things which we can ponder upon. So first of all, technology integration. As I am a radiologist and now endovascular intervention radiologist also. So in intervention radiology, we have to have X-rays, ultrasound images, X-ray images, CT images, MRI images, and then the DSA, digital subtraction angiography images in toto. That images which we will collect from the patient, that will help us in treating the patients. How it will help? Suppose if I have done the renal artery angioplasty or peripheral arterial disease angioplasty or stenting, if we have done it, and after putting the stent, if we call the patient again after 1 month, 3 months, 6 month gap period. So that integration of that electronic, that his information system that is there in our lab, so that we can see the images before. If again patient came to us with claudication, so we came to know that this patient needs this much of angioplasty from this segment, and this will help for the patient-centric approach. Then again, telemedicine is coming up. Telemedicine is coming up right now from long way, and if you see, if the patient if data is with us, then we can help in patient's treatment in any way. Suppose the patient has any drug reaction, if the contrast reaction is there in CT, we came to know that this patient, we cannot give the same contrast like Imaron or any agent. We cannot give to that patient again. Or if any allergic reaction is there in any patient, so we came to know by having that data that we should not have to give that very medication to that very patient. Second thing is the private-public partnership. We cannot go, the government cannot treat patients alone. We have to have private backup. The NGOs are there, lots of people are there which can help the government in treating the patients. So that is very much important. Third thing, the prevention. The prevention is always better than cure. Now you can see lots of people. When we treat the patient, suppose if we treat peripheral artery disease, lots of people are tobacco chewers, khani, jarda, kuch bhi, they eat anything. So cognitive behavioral therapy, behavior therapy is the utmost care which we can provide to them. How we can provide? Suppose a patient came to me, so I will examine him, and there is guidelines that we cannot treat that patient if he is not cessation of smoking from last 3 months. अगर वो 3 महीने में वो अगर वो फिर भी कर रहा है तो जो एंजियोप्लास्टी के रिजल्ट्स हैं that will not be the same. Again the re-stenosis rate will be very higher in those patients they are smoking tobacco. So हमको उनको बताना पड़ेगा कि जो भी वो खा रहे हैं, जर्दा खा रहे हैं, तंबाकू खा रहे हैं, बीड़ी पी रहे हैं, उनको बिठा के बिहेवियर थेरेपी देनी पड़ेगी कि नहीं, और उनको साइकोलॉजिस्ट के पास भेजना पड़ेगा कि निकोटिन पैचेस जहां उनको बिहेवियर थेरेपी प्रोवाइड की जाए, सो दैट दे कैन उनकी जो हेल्थ है वो और अच्छी रहे. और दूसरी सबसे इम्पोर्टेंट बात, जो भी जितनी भी आज क्रोनिक डिजीज आ रही है, डायबिटीज आ रही है, हाइपरटेंशन आ रही है, कुछ भी आ रहा है, दैट इज बिकॉज ऑफ अवर किचन ओनली. अगर हम किचन को अच्छा कर लें, हमको पता होना चाहिए कौन सी चीज बेनिफिशियल टू अस, कौन सी चीज डोज और हार्मफुल. जैसे सपोज करो नमक, जस्ट चुटकी भर नमक हमको लेना होता है, और हम खाते कितना है, बहुत सारा. अगर हम हमारी वेजिटेबल्स जो बनती हैं तड़के के साथ लगती हैं, उसमें अच्छे से तड़का लगा होता है, उसमें अच्छे से घी डाला होता है, अच्छे से नमक डाला होता है, तो दैट इज द क्रक्स प्रॉब्लम जो हमको देखनी पड़ेगी कहाँ पर लैग है. मैदा, हम हाई कार्बोहाइड्रेट कंटेंट इतना ज्यादा कंज्यूम कर रहे हैं, हमको पता नहीं चल रहा. हम चाय पीते हैं तो हमारे को कुछ भी दाल मोठ चाहिए, कुछ भी कचौरी चाहिए, कुछ भी चाहिए, समोसा चाहिए. सो दैट इज द प्रॉब्लम. वो हमको देखना पड़ेगा कहाँ हमारी प्रॉब्लम लाई कर रही है. हमारे को प्रिवेंशन इज ऑलवेज बेटर देन क्योर. फिर इनोवेशन एंड रिसर्च में आपको काम करना पड़ेगा. आर्टिफिशियल इंटेलिजेंस कितना अच्छा अभी रोल प्ले कर रही है. अगर सपोज करो मेडिकेशन ले रहे हैं, उसको ऐप्स में बता दिया कि दिस इज द टाइम टू टेक एंटी हाइपरटेंसिव ड्रग, दिस इज द टाइम टू गेट द टेक द डायबिटीज ड्रग. सो आपको ये देखना पड़ेगा कहाँ पर हम लैग कर रहे हैं. फिर स्ट्रेंथनिंग ऑफ द प्राइमरी हेल्थ केयर सेक्टर. हम टर्शरी हेल्थ केयर सेक्टर में बहुत काम कर रहे हैं. 22 एम्स खुल चुके हैं पूरे इंडिया में, और आने वाले टाइम में अगले 2 साल में 26 हो जाएंगे. तो कहाँ हमारा प्राइमरी हेल्थ केयर सेक्टर को हम स्ट्रेंथन कैसे कर सकते हैं? आप इफ यू गो टू रूरल बैकग्राउंड, आप देखोगे वहां पर अच्छे से इवन पैरासीटामोल भी अच्छे से प्रॉपर नहीं मिल पा रही. हमारे को ग्रास रूट लेवल पे हमको काम करना पड़ेगा. प्राइमरी हेल्थ केयर सेंटर को, पीएचसीज को स्ट्रेंथन करना पड़ेगा, डिस्ट्रिक्ट हॉस्पिटल को स्ट्रेंथन करना पड़ेगा, जो हॉस्पिटल है उसको स्ट्रेंथन करना पड़ेगा. अगर हम ये नहीं स्ट्रेंथन कर पाए तो टर्शरी केयर सेंटर का कोई फायदा नहीं है. जब तक हमारा प्राइमरी हेल्थ केयर सेक्टर नहीं अच्छे इसको स्पेंड कर पाएंगे, दैट इज वी आर डूइंग द ब्लंडर. और जीडीपी स्पेंड ऑन हेल्थ इज मेयरली 1.8%. आप बांग्लादेश देख लो, श्रीलंका देख लो, जो आसपास वाली कंट्रीज हैं, उन्होंने हेल्थ केयर सेक्टर पे जीडीपी कितना अच्छा स्पेंड कर दिया है. यूएस यूके की तो बात की बात है, कम से कम 5% जीडीपी चाहिए स्ट्रेंथन करने के लिए हमारे को अपना एंटायर हेल्थ केयर सेक्टर. अगर हम नहीं कर पाए, दैट इज रॉन्ग. अभी भी 10 साल हो गए, इस गवर्नमेंट को भी उन्होंने थोड़ा और ऊपर किया है, जीडीपी इंक्रीज हुआ है, और हमारे को चाहिए कि और अगर 5% तक हो जाता, दैट इज द बेस्ट थिंग फॉर एनी फॉर द पेशेंट्स, गुड फॉर द डॉक्टर्स. फिर बात करते हैं स्ट्रेंथनिंग ऑफ स्किल्स ऑफ ऑल डॉक्टर्स. जितने भी डॉक्टर्स हैं, पैरामेडिकल स्टाफ है, उनको खुद को स्किल्स उनके हैं उनको स्ट्रेंथन करना पड़ेगा. अगर सपोज कोई सर्जन है, उसको सर्जरी की है, लेप्रोस्कोपिक सर्जरी की टाइम हो गया है, कोई एडवांसमेंट देखनी पड़ेगी, कौन सी नई चीज आ गई है. वी हैव टू स्ट्रेंथन अवर नॉलेज सो दैट वी कैन हेल्प द पेशेंट केयर. सपोज मैं इंटरवेंशन रेडियोलॉजिस्ट हूँ, अब मेरे को पता है कि अगर एंजियोप्लास्टी करनी है और नए स्टेंट्स कैसे आ रहे हैं, बलून कोटेड स्टेंटेड कैसे आ रहे हैं, कैसे बायोमिमेटिक स्टेंट्स आ रहे हैं, मेरे को पता होना चाहिए. मेरे को वो कैसे होगा. वी हैव टू अटेंड वेरियस सीएमईज, वी हैव टू गो एंड स्ट्रेंथन आवरसेल्फ, वी हैव टू गो टू वेरियस कॉन्फ्रेंसेस, वी हैव टू टेक लेक्चर, वी हैव टू स्ट्रेंथन आवरसेल्फ. अगर हम खुद नहीं अपने आप को स्ट्रेंथन कर पाएंगे तो देन इट इज नॉट राइट. सो वी आर गिविंग नेगेटिव इंप्रेशन टू इन फ्रंट ऑफ पेशेंट्स. और सबसे इम्पोर्टेंट बात, पेशेंट सेंट्रिक केयर के लिए सबसे इम्पोर्टेंट बात जो हम भूल चुके हैं, मैंने कहता सभी डॉक्टर, मोस्ट ऑफ द डॉक्टर्स की, हम क्या करते हैं, पेशेंट हमारे पास आता है, पेशेंट को अगर वो आता है तो हम उसके पास उनको अच्छे से बात भी नहीं कर पाते. वो जो कोडियल रिलेशनशिप जो पेशेंट डॉक्टर पेशेंट रिलेशनशिप है वो कहीं ना कहीं मिसिंग हो रहा है। आप कॉर्पोरेट सेक्टर में देखा जाए तो बोर्ड लगी हुई है कि मेरे को ये टारगेट्स कंप्लीट करने हैं, तो टारगेट्स कंप्लीट ठीक है, आपने जो आपके दिमाग में चल रहा है आप उस पर भी वर्क करो, पर पेशेंट को पहले रखते हुए अगर आप अच्छे से उसको एक बार बात भी कर लेते हो ना, तो उसके 50% से ऊपर उसका दर्द वैसे ही खत्म हो जाता है। So we have to make cordial relationship between the patient. So doctor-patient relationship is the most important thing which we can do right now. और जी मोबाइल हेल्थ, जो मोबाइल हेल्थ अभी इम्पोर्टेंट सिस्टम है। अभी मैंने अभी स्टार्टअप देख रहा था हाल ही में कि टेली कंसल्टेशन के माध्यम से आप रूरल में जाते हो तो आप 8x8 का भी अगर उधर एक छोटा सा कमरा स्थापित कर दिया जाए तो वर्चुअल कम्युनिकेशन, दूसरी अगर दिल्ली में बैठा है, मुंबई में बैठा है या कहीं भी बैठा है, इवन न्यूयॉर्क में भी बैठा है, तो he can take the history, he can get all the instructions to the patient on the same time. और क्योंकि डॉक्टर को उधर रीच करना अगर मुश्किल है तो मोबाइल इज वेरी इंपॉर्टेंट माध्यम। वर्चुअल जो कंसल्टेशन है, टेलीमेडिसिन है, वो आजकल बहुत इंपॉर्टेंट रोल प्ले कर रही है। वो मैं आपको आज इस पोडियम के माध्यम से आपको यही मैं कहना चाह रहा हूँ, हो सके 1 या 2 घंटे सैटरडे या संडे, जहाँ मंडे टू फ्राइडे उसी टाइम पे भी आप अपना ये सेटअप तैयार करें मोबाइल हेल्थ का, जिसमें आप कम से कम 10 पेशेंट रोज के, और हो सके अगर हफ्ते बाद देख रहे हो, सैटरडे संडे देख रहे हो, तो 100 पेशेंट आप कम से कम जरूर देखें। अगर आप ये टारगेट हम अचीव कर पाए तो आई थिंक वी कैन रीच टू ग्रास लेवल टू द पेशेंट। रूल बैकग्राउंड अगर उनको स्ट्रेंथन करना है तो हमको ही करना पड़ेगा। हम जितने भी हम कॉन्फ्रेंसेस करते हैं, सीएमएस करते हैं, दैट इज गुड, वेल गुड, बट हमारे को ग्रास रूट लेवल पर अभी भी हम बहुत ही पिछड़े हैं। मैं कहता हूँ इंडिया, आप जहाँ भी रूरल बैकग्राउंड में जाओगे, जहाँ भी जाओगे देखोगे वहाँ पर आपको सेम चीज नहीं मिलेगी। और गवर्नमेंट को कुछ चाहिए कि यूनिवर्सल हेल्थ केयर फॉर ऑल, it should be easily accessible and affordable to whole, either he is rich or he is poor. अगर जैसे जेनरिक मेडिसिन का कॉन्सेप्ट लेके आई है गवर्नमेंट की, जेनरिक ड्रग्स ही यूज करनी है, तो उसको पता है कि इवन जो डॉक्टर भी उधर है तो वो हो सके तो ज़्यादातर जेनरिक ड्रग लिखे जिसके कारण पेशेंट को भी फायदा हो और उसको इजीली एक्सेसिबल हो जाए वो ड्रग्स। और उसमें जन औषधि जैसे स्कीम स्टार्ट हुई है और आयुष्मान भारत में जैसे काम चल रहा है, तो उसमें इंटीग्रेशन भी हो रही है और साथ साथ ये फार्मेसी वाला काम भी चल पा रहा है। और जब ये जितना डाटा हमारे पास आया था, सिक्योरिटी का बहुत बड़ा इशू है, तो जितनी भी गवर्नमेंट एजेंसी हैं या प्राइवेट एजेंसी हैं, वो जैसे हमारे हाल ही में आपको पता होगा एम्स न्यू दिल्ली में पिछले साल इतना बड़ा थ्रेट आ गया था, पूरा डाटा हमारा खत्म हो गया था, पूरा डाटा हमारे को जनरेट नहीं कर पा रहे। अभी तक इतना प्रॉब्लम आ रही है कि डाटा जनरेट कर पा रहे। एंटी हैकिंग सॉफ्टवेयर हमारे को एस्टेब्लिश करने पड़ेंगे कि डाटा है तो उसको साइबर सिक्योरिटी से भी लिंक करना पड़ेगा। थैंक यू वेरी मच। And I thank Gaurav Gautam ji and whole organizers for inviting me as a guest of honor. Thank you. Thank you all.
Thank you so much, sir. I would like to invite all the panelists over on the stage. Kindly please come forward and take your seats. Dr. Chandra Bhushan, everybody, with a round of applause, please welcome your senior dental surgeon specialist in single visit root canal, and he is Associate Professor, Department of Psychiatry, JLN Medical College, Ajmer. Everyone with a round of applause. Let's welcome our another panelist, Dr. Lakshman Malgunje, Director, 72 Hours Smile Care Center, Director of 72 Hours Smile Care Center, Dr. Lakshman. Please welcome him with a round of applause. Next, I would like to welcome on stage Dr. Rajiv Prasad, Director of Visual Eyes, Senior Clinical Optometrist. With a round of applause, please welcome on stage Dr. Rajiv Prasad. Everyone. One space left. If anyone wants to join by their own will, they can come and join the panel. Okay, I will tell the topic first. And I'm going to brief about it, so please come and join. Digital health solutions are powered by technologies such as artificial intelligence and machine learning. Adopting these with prevention, diagnosis and cure can help India run closer to the goal of digital health for all. To discuss this in details, we have a panel discussion on healthcare ecosystem for New India, the change it needs. In this special panel discussion focusing on digitalizing healthcare in India, we are going to discuss and explore the impact of COVID-19 pandemic on healthcare delivery across the country and how the pandemic has accelerated the needs for an integrated digital healthcare infrastructure and technology-led initiatives such as digital health missions. We have a serious long-term impact on healthcare infrastructure. I think we should start with...
Good morning, I am Dr. Abhishek. I am actually country head and CMO of Nuvoco Vistas Car Limited. We are a very big cement organization. So, the topic of this discussion is digital health. As Sardarji has rightly told, mobile health and digital health is essential thing for all physicians. I am associated with teleconsultation, one Geo Innovation. They are working for rural health. It is our CSR part. So, from COVID, we are seeing lots of patients by telemedicine only. As you said rightly, we are able to touch rural population really at time of COVID when no one were there for consultation. Our team took that challenge and we have taken that initiative. Thank you.
Thank you so much, sir. Next, I would like to share your words, sir.
Hi, I'm Dr. Rajiv. I'm a senior optometrist. Presently, I have my 3 centers in Bihar, Jharkhand, and New Delhi. Next month, we are opening in Noida, Gurgaon also. I was very patiently listening to Dr. Joshi on the smart vision glasses. So, I'm primarily into vision rehabilitation, and all my centers are completely on vision rehab. So, we love to take failures. And in terms of failures, when I say whether it is a patient of diabetic retinopathy, optic atrophy, macular degeneration, or whatever, the vision is lost. So we take primarily all those cases. And what I have learned in these days, and which I would like to share with you is, when we talk about eye, it is not just the eyeball. It is much more beyond that. It is all about vision. And vision is really, really important. It is not only what you see, but what your visual processing which is happening. Post-COVID, as the topic states, what has happened is almost every second child is now getting glasses. You go to any school, when we were in childhood, out of 50, there were two kids who were using glasses and we used to call them, chashmish or something like that. But now almost 20-25 kids are wearing glasses. What has happened is, childs are more onto screen. As a treatment part, what has come up gradually is new glasses, new contact lenses, everything. And what Dr. Amrinder was talking about, patient-centric approach and behavioral, it is really, really important. When we talk about myopia management, we should talk about environmental and lifestyle changes more than actually just, dispensing glasses or dispensing all of those stuff. So if the child is seeing more at a distance, those things are really important. And there are artificial intelligence devices where you can just put the age of the child, the current prescription, and that will tell what is the possibility of child becoming myopic more, and till what age what would be the far. So all of these things can be done after getting into artificial intelligence. Rolling nowadays, I think a lot of things has been made easy. Currently we are seeing patients from more than in 20 countries every week. I personally do almost 20 patients from different countries. Online teleconsultation, as Dr. Amrinder said. Thank you.
Thank you very much, sir. And let's just move forward.
Hello, I am Dr. Lakshman Magunja. As I already introduced myself, as I and Dr. Uma Kandole. We both are the director of 72-hour Smile Care Center in Pune. We have 20 to 23 branches with this dental department. And the main attraction of the center is at every center you got the same doctor for every treatment. Means you got responsible person for that. Okay. What we did nowadays, you know, people for the treatment of missing teeth we require at least 3 to 4 visits to the dentist, at least 3 to 6 months. But with the new science, I learned this from the German Dr. Stephen Ide, and with this science we restore patients' teeth within 72 hours. That's why I give this name to this center. Again, what I realized in this situation, how digitalization help, because patient have to come to you for the checkup, but in digital area there is no need to physical checkup. You can check up with the WhatsApp call also, video consultation also, and you can give directly appointment to the patient. And on that criteria, there are so many patients are coming from different regions of India to my center directly for the treatment, not for the sake of the diagnosis, and 2 or 3 visits are not required. So they directly came to me with their all reports and for the surgery. So we globally we made that center as like a patient has to come to airport, then we pick up that patient and then we give to the hotel's residency, then all treatment, and the patient is back to the house. After COVID, what changes are made in the dentistry? Do you guys know the mucormycosis disease? After COVID, there is so much of patient of mucormycosis. Before COVID, we found that there are 2 to 3 patients in a year. But in COVID era, I literally operated 2 to 3 patients daily basis. So after COVID, there is a loss of all bone and all things. Then I found that this type of implant system, that is what I am using, without any admission, without any general anesthesia, I can give the tip to the patient within 72 hours. That I feel proud of myself, because the patients are hopeless. They are not I can give the best treatment by this method, so I feel proud of it. Thank you.
Thank you very much, sir. And now I request to sir, kindly please put some light on the topic.
Thank you, ma'am. My name is Dr. Charan Singh Jilawa. I'm Associate Professor in Department of Psychiatry, JLN Medical College, Ajmer, Rajasthan. As the topic suggests that we are talking about the current ecosystem in India and what we can do in the future. The speakers before me, they very well told about the need we need in the current time. First, we need to increase the number of budgetary allocation for the health. As sir said, we are spending hardly 2.5%. In fact, we are making the goal to spend our GDP in terms of percentage 2.5% for the health. In this whole health budget, as I am dealing with the mental health, can you guess what is the percentage of the budget that goes to the mental health? In financial year 2023-24, it was just 1200 crores for the whole country. And in this 1200 crores, 94% was just for 2 institutes. One is Nimans Bangalore, another is in the Tezpur, Assam. And rest 6% is for whole country. So you can guess the condition of the budgetary allocation for the mental health. And that's why the condition of the mental health in India is in very bad shape. See, after diabetes, we are the suicide capital of the world. Can you guess what is the number of suicide every year in India? Anyone? It is almost 2 lakhs. And what was the number of death by COVID in last 2 years? As per the website of Ministry of Health and Welfare, it is more than 5 lakhs. But people are dying more than 2 lakhs every year because of suicide in India. And no one is talking about that. So, it is a huge number. And we need to focus on mental health. The reason being, our mind is the engine of our whole body. The body follows the mind. I'm not saying that the body doesn't have any importance. No, it is equally important. But the thing is, if your mind is not okay, nothing will be okay in your body or in your life. So we need to be very careful about the mental health in terms of that we need to go, like Sardarji said, we need to move in our kitchen for the health. Our kitchen is, it is a dual-edged sword. It can be very harmful for you, it can be very beneficial for you if you are using the tools present in the kitchen in a proper way. We are sleeping around 11, 12 and sometime 1 or 2 in the morning, and we are expecting that our mental health would be good. We are designed to be in the sunlight for 60 to 70% of our whole day. But see how much time we are spending in the sunlight. We are designed to keep moving whole day, but we are sitting in a chair for hours. Sitting in a chair for 2 hours is like smoking 1 cigarette. But because we need to earn money, we need to be Ambanis, but you cannot be winner at both the poles. If you are earning, because you are dealing with your US clients in the night, you have to be patient. You cannot be winner at both the poles. Because as Sir was talking about the heart attack and cardiology, those who are not sleeping 7 to 9 hours, or if I say it, I reshape it, this sentence, if you are not sleeping less, if you are sleeping less than 6 hours in a day, in the night, the chances of cardiac problem or death related to heart would be 300% more. If you are not sleeping in daytime, a small nap, the chances of death because of the heart problems would be 37% more. So your sleep is directly related with your whole body function. Likewise, so many things. Like we have forget to do exercise, moving our body around the clock or for the sufficient time at least. So there's so many things. And one important thing which I want to discuss from this platform is stigma. You will be surprised to know, as the education level goes up, the chances to consult a psychiatrist goes down. Surprising. 1% doctor in India die by suicide. That is very unfortunate. क्या डॉक्टर्स को पता नहीं है कि कहाँ इलाज होना है डिप्रेशन का? But the reason being, I'm sorry to say, stigma. यार मैं साइकाट्रिस्ट के पास जाऊंगा क्या? But भुगतना किसको पड़ेगा? Your kids and your wife, your family. And 1% is not a small number. Like in India, anesthetics number are on the top in committing suicide. So stigma is one of the important reasons when it comes to the literate people. If we talk about the illiterate or the people from the rural background, then it is a lack of awareness or lack of information. They don't know where to go. And that's why आपने देखा होगा कि आज भी दोहरे ताबीज बनाने वाले खूब फ्लरिश कर रहे हैं. आज भी लोग दोहरे ताबीज बनवाते हैं, झाड़ फूक करवाते हैं. उनको लगता है कि उनके हाथ की रेखाओं में सब कुछ है. When their life is not going on, they don't focus on their thoughts. They focus on their palm. So mental health is a very important issue. And another one important topic is the life expectancy of doctors in India is going down. It is below the average. The average life expectancy in India is around 70-72 years. What is the life expectancy in India for doctors? Anyone? 60. Around 60. Your patients are living more than you. So you need to be very vigilant. And I have seen in last my 10 years of clinical experience, doctors are very poor in terms of handling stress. I always advocate exercise, sunlight, earthing and proper sleep. One of the doctors has made some record of doing cardiovascular surgeries in Gujarat and died very young age. So what is the benefit of making that kind of record if you are not sleeping well? So first health, then your profession. And in health, I would say first mental health. और इसीलिए हमारे पुरखों ने कहा है, if you have good sleep and good appetite, you are perfect. And if you are lacking any one of these two things, there is something wrong. और नींद के बारे में 90% लोगों को नहीं पता है. नींद is something like God and love. Everyone talks about God and love, but they don't know nothing about it. I love you, but they say every day, but they don't know anything about love. See, I say love is not emotion, it's a logical decision. But if you ask anyone, they will say it is an emotion. No, love is not an emotion. It is all about logical decisions. That this is my partner and I am supposed to live in every damn situation with the shortcoming of this person forever. That is love. It's not love ki you are looking good and I want to live with you. No. So it starts with your mind, and one endocrinologist, I forgot the name, she says 80% of your life problem starts with your mind. 80%. So there is a lot to talk about it, but see, other panelists are sitting also. So I'm stopping here. Thank you very much. Thank you.
Thank you very much, sir.
Hello everyone, this is Dr. Bhushan, running a dental clinic in Chhatarpur, Delhi, and practicing since last 5 years. And I developed this skill in terms of field of root canal treatment. I am doing since last 5 years, and there is very much change in last 5 years I have seen. That time the patient was very fear. Root canal hoga, and it's like 3-4 visits for us. And now I develop my skill to finish it in 30 minutes, not more than that, and it should be painless. So still people think कि नहीं pain होगा यार नहीं जाते हैं अभी रहने देते हैं and painkiller ले लेते हैं, and then they left the treatment. And what will happen? थोड़े टाइम के बाद people feel कि they are feeling bad odors and smells and all other issues. People don't think even a single time for our oral health. People think कि just oral health is like elective science, you'll leave it as it is and one painkiller will subside everything. But no, it's not like that. It leads to heart disease, it leads to diabetes, it leads to your mental health also. So in my clinical practice last 5 years, I was not able to cater many peoples. I was not able to aware peoples to get the oral health done as soon as possible. So what I did, I joined a government hospital, the Deen Dayal Upadhyay, I joined there. I counsel more than 10 peoples daily. I cater 150 peoples daily in OPD as well as in treatment center. So what people think, yeah, I was having tobacco from since 15 years, I don't have any problem, I don't have any issue. But what will happen? जहर कितना खाया जाता है? कोई जवाब देगा इसका? थोड़ा सा. People कहते हैं कि मैं थोड़ा सा लेता हूँ, 1 खाता हूँ, 2 खाता हूँ. मैं उनसे ये कहता हूँ, जहर कितना खाते हैं? Just a pinch of. But ठीक है, I am guiding those peoples. But still lack of knowledge की वजह से बहुत सारे people अभी cater नहीं हो पा रहे हैं. But I am trying my best in the field of dentistry as well as what happened. That's it. I am trying to help people. That's it. Thank you so much. Thank you.
Thank you so much, everyone. But I think we should put some light on the COVID issue as well, as we have mentioned it in the panel discussion topic, and what the change we actually need, what we can do better to, get the something good in future. So, is anyone have some idea, or they can suggest any ideas?
Actually, as all panelists have emphasized and earlier speakers have also told, we need good healthcare infrastructure in terms of doctors, in terms of hospital, in terms of patient bed ratio, in terms of emergency preparedness. that part is lacking. Like very good program right now, AIMS Raipur is doing one hand CPR program for in Chhattisgarh. So our general population, they don't know if heart attack comes here, and we are having no knowledge of CPR, then no use. So general awareness to general public is also essential. Yeah. Thank you.
Thank you, sir. So would you like to say something?
Yeah, I think awareness is the key, because even post-COVID what has happened is, prior to COVID I remember हम लोग बच्चों को बोलते थे दूर से टीवी देखो नहीं तो आँख खराब हो जाएगा. Post-COVID our version changed. We only started buying mobiles and laptops, class करो.
Exactly.
And what has happened is बच्चे स्क्रीन पर हैं और ज़्यादा स्क्रीन पर है, definitely it is harming their eyes. पहले बच्चे बोलते थे कि पापा आपने तो मना किया था, नहीं अभी क्लास करो ज़रूरी है. So it is really important that when we talk about awareness post COVID, we have to change our thinking. हम लोग एक चीज़ पर फोकस शायद मेडिकल फील्ड में नहीं करते हैं, that is improving the quality of life. We always go on treatment side, but there is much more beyond that, because when I see a patient of low vision, it is really important. One thing is definitely we see the quantity of vision कि 2 लाइन नहीं पढ़ रहा है, हमने devices दे दिया और 2 लाइन पढ़ गया उसका टेलीस्कोप से, मैग्नीफायर से. We never think much more beyond that. People who have retinitis pigmentosa, रतौंधी जिसको बोलते हैं, वो आप सोचो कि 60 साल का आदमी रिटायर कर गया, he is not able to read newspaper, he is not able to watch television. उनके grandchildren आके पूछ रहे दादाजी दादी क्या लिखा है, बता नहीं सकते, and that leads to depression, and that is where the mental health comes in picture. We just see the subject. In eye clinics we see just the vision. इतना लाइन पढ़ लिया मतलब आप ठीक है. But we never work on improving the quality of life. It is really important that when we start working on treatment part, there is much more beyond that. At this moment, I am the only sports vision certified professional in the country from US. अब sports vision post COVID क्या change हुआ मैं example बताता हूँ. Rajasthan Royals wanted to improve their performance during this COVID time, because कहीं match नहीं हो रहा था, कुछ नहीं हो रहा था. What has happened? They invited sports vision people from US, और 15 दिन के training में when the professionals went back, then they called me, Raji, what is happening? Because at this moment actually I am president of Asia Pacific Council of Optometry. So, and what they said, when we play cricket, we always see the ball, we never see the bat. Our vision may be 6x6, दोनों आँखों से साफ-साफ दिख रहा है. But if eye-head coordination is not good, sensory motor integration is not good, what will happen? बॉल जिस स्पीड से आ रहा है, हम या तो उसके पहले हिट कर रहे हैं या उसके बाद हिट कर रहे हैं. उसी तरीके से बच्चा कोविड के बाद से स्कूल में उनकी अटेंशन कम हो गई है, वो हाथ से लिख नहीं पाते, उनकी हैंडराइटिंग खराब हो गई, बिकॉज 2 साल तो लिखना उन्होंने छोड़ दिया. So it has really impacted in a bad way. In our clinic we work on improving all of these aspects कि कैसे इसको improve कर सकते हैं. बच्चों की बच्चा ऐसे बोर्ड पे देख रहा है, ऐसे लिख रहा है, ऐसे देख रहा है, ऐसे लिख रहा है. अगर विजुअल प्रोसेसिंग नहीं हो रही और बच्चा प्रॉपर्ली नहीं देख रहा है, अल्टीमेटली वो समझ नहीं पाएगा लिखा क्या. वो तेरा ध्यान कहाँ है. It is all about the brain-eye connection which has to be established first to see and spell out कि दिखता क्या है. अगर brain और eye coordination नहीं है, नहीं दिखेगा. And for this, to explain this, मैं एक छोटा सा exercise 1 मिनट का आपको बोलूँगा करने के लिए. Can you please stand up for a while? Just one quick thing.
And everyone also, we have our honorable guest here, and I request everyone kindly with our honorable guest. श्री संतोष जी, जोरदार तालियों के साथ हम उनका स्वागत करना चाहेंगे. फॉर्मर मेंबर ऑफ पार्लियामेंट, राज्यसभा, फॉर्मर कोल मिनिस्टर ऑफ इंडिया. एवरीवन विद द राउंड ऑफ अप्लॉज वंस अगेन प्लीज वेलकम श्री संतोष जी.
So I was connecting like एक बार प्लीज खड़े हो जाइए फिर से. सो लोग देखते किससे हैं? आई से. ये आंसर सबका है?
जी बिल्कुल.
ओके. एक बार कोशिश करते हैं, एक बार एक पैर पे खड़े होने का. लेट अस मेक दिस बैलेंस. ट्राई टू डू.
सर मैंने बहुत बड़ा हील पहना है.
एक बार पैर ऊपर कर लीजिए, वापस नीचे कीजिए, फिर से पैर ऊपर कीजिए. क्लोज योर आईज. एक पैर पर आकर के आंखें बंद कर दें. व्हाट इज हैपनिंग? डिसबैलेंस. हम आंखों से देखते हैं ना, पैर पे खड़े, ये डिसबैलेंस क्यों है? Please.
The brain is getting the sensor, I guess.
Exactly. So what is happening is, जैसा अभी सर ने बताया था, mental health 80% of the information what we get is through our eyes.
Again, as per I'm an maxillary surgeon, what I found already done that after COVID, the human disease. So we have to keep our oral cavity clean always.
So, sir, if you want to say something, just make it a short.
I just want to highlight few things. Like after COVID, the mental health problems has increased 25%. We are seeing more patients of anxiety and depression, OCD. They were less before the COVID, but now they are increasing. One more thing which I want to mention here is, see, the dangerous thing with the mental illness is, there are certain psychiatric problems where patient is not aware, including us. Agar hum
these healthcare areas, traveling to the ungeographical accessible areas, rural areas, the rightful points has been said. But are there any policy being implemented currently? Now when sir said about mental health, I do appreciate your point on mental health. But in 2019, the AMR, antimicrobial resistance, had attributed to almost 3 lakh deaths in 2019. Almost 10 lakh deaths are closely associated with AMR. Now, there has been a protocol in December 14 that we should celebrate it as antimicrobial week. But are we, the hospital or the tertiary healthcare people, doing enough to find the real cause? Because when the patient visits the hospital, he carries the infections along with him to his household. He goes to his household, touches his children or whatever things, and that spreads rapidly. So this is one of the key areas apart from mental health, because mental health is also one of the factors is associated with a lot of deaths. But these are modifiable changes like your diabetes, your hypertension, your blood pressure and all. These are modifiable, but these AMR can be modified if we create a good ecosystem in the hospital tertiary sector. Because we have the people in the rural setups, the CHC, the headquarter hospitals, the sub-centers, but to treat all those, we are lacking behind with proper public health professionals who can bridge the gap between the hospitals and the rural hospitals, right? These are, and try to curate their CSR activities and like promote themselves that they can also.
Really appreciating your point, and thank you so much all the panelists for joining in. Now you can take your seats, and thank you so much. We have Shri Dr. Amrinder Singh Mahri ji, Assistant Professor in the Department of Radio Diagnosis and Interventional Radiology, AIMS, New Delhi. We have with us Dr. Saurabh Sharma, Director, Principal, Chandigarh College of Pharmacy and Biotechnology. Everyone, I request kindly please stand up at your own position, and with the claps, let's just give the privilege of this beautiful moment. We are lighting the lamp and making this wonderful day more wonderful with all of your presence and prayers.
वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा वक्रतुंड महाकाय
We also have our Director of Hypedge, who actually did a great job to organize this beautiful event, Global Healthcare and Wellness Awards and Conference 2023. We are thankful. Thank you so much.
I mean, this is not an excuse, but I want to tell you how it happened in a second. Because of bad weather today, all flights were disturbed, and I need to go to Jaipur just now, and the flight got cancelled. I had to reorganize everything. My secretary was, at least 3 of them working hard to find out how do I reach Jaipur, because all the schedules in Jaipur had to be changed. So in the process I got late, and I'm really sorry for that. honored to stand before you as we convene to address the critical issues in global healthcare and wellness. Our world is intricately connected, and the challenges we face transcend borders. As we navigate this conference, let us emphasize collaboration, innovation, and inclusivity in our pursuit of accessible and effective healthcare solutions. Today, we can inspire positive change and make strides toward a healthier and more equitable future for all. Education and health are two important things in everybody's life, and they are very dear to me because health-wise, I think I have faced the greatest problem in my own life. I lost my son after a fight for 22 years for cancer. And very closely I watched from 92 to 2010 or 2013 till he was alive, how difficult it was in our country. Even a thing like PET scan was not available. I had to take him take my wife to way back in 96 to US just for PET scan. I'm not blaming the government. I'm not blaming any individual. I'm telling you a situation. Because every development takes time and everything requires resources. But I'm closely seeing that how important it is to go with the best development in the world, particularly on education and medical. And now I'll stick to medical. I don't know how my doctor friends and my officers from the government will accept it. US, in my opinion, is at least the value of the dollar and rupee is 80 rupees. I will not say 80 years, but at least 20 years we are behind in medical. We have a long way to go. It is not impossible with the kind of development happening in our country, the way the economy is developing. I'm sure very soon we'll be able to do the best. I don't know if there are some cancer experts also here. Even now, recently, many cancer people in my relations, my friends, we lost them or they can't get treatment. The new development what is taking in US, which is on trial, we don't have permission even to get trial for those medicines. I really don't know how the government can help. That we can get at least the permission, whatever is being tried here, can we not try here? Of course, it should be, we have to follow the proper procedure. I know we can't get everything what is available there, but at least the permission has to be there. Maybe there are very developing institutions, hospitals, who may be willing to bring that. When we are talking about, our government talks about medical tourism, I think big hospitals are absolutely booked. Not only from neighboring countries, from African countries, even from Arab countries. We have extremely good doctors. Of course, the support system is very weak because unfortunately There are a lot of opportunities for the trained nurses, etc. outside the country, and they go there. We all have to ponder, how do we get the best? Global healthcare and wellness face challenges such as unequal access to healthcare, rising costs, infectious diseases, mental health stigma. Just now I heard about mental health, I would like to speak a few words on that. And the need for effective preventive measures. Addressing these issues requires international collaboration, innovative solutions, and a focus on both physical and mental well-being. Mental health is a great stigma. One of the gentlemen here, a doctor maybe, we were talking about that we should say that I have a mental problem. We are not aware. He says, I beg to differ with you. We are aware. The psychiatrist knows that he himself has a problem. I know I have a problem, but I don't want to express it. For two reasons. Because of the word stigma. Mental health means pagal. Nothing different. If I have a mental problem, I should definitely go to a psychiatrist or a psychologist. But the other problem which ordinary citizen faces, sir, is that there is a strong feeling that if I go to the psychiatrist, for the rest of my life, I will be stuck with him. Or to a psychologist. That is one fear. If a young man goes, probably he will never be married. Because they will think, oh, pagal. He goes to the psychiatrist or he goes to the psychologist. So this is where awareness has to come from all of you, that it is not a really bad thing to go to the psychologist or to the psychiatrist. Today's day, institutional or hospital care is equally supported by non-institutional care, preventive care, home care, care through telemedicine, digital modes. The focus is no more on illness, but more on wellness. How to keep one healthy and practice holistic health so that one seldom requires hospital care. One of the gentlemen said that, eat whenever you are hungry, sleep enough, sleep at 10 o'clock. All these things are good things. But we are so greedy. हमको खाना मिल रहा है, पूरा खा लो, चाहे हमारी तबीयत खराब हो जाए. The cook has made, I must eat it. I am not going to leave it either for my health, because it's a good food, I must have it. I make my stomach a gutter. Let that food go waste, doesn't matter. I don't want food to be wasted anyway. But if a situation arises between the waste and your health, let us choose our health. No doubt about it. The very ill persons who still need hospital care should be given uniform, standardized care for all. We must develop quality hospitals. Now that our number of hospitals are growing, we are producing enough doctors and nurses. Like all developed nations, all our hospitals, be they public or private, big or small, should start delivering standardized care to all proper clinical care and patient safety standards. Why do I mention this? In '92, first time when I took my son to Seattle for CML, for BMT, I don't know if these words are known to every individual here, bone marrow transplant. Fred Hutchinson is the top hospital in the world who were doing at that time. As we have practiced in India, we have got a private doctor, physician who goes with us to all these specialists. Some specialists don't entertain you unless you have a private doctor of your own. Maybe things are changing. So I thought, why not I take one doctor with my son so that he can help us with the doctors locally there. I told the doctor there that this is my doctor, I can call him. He told me very categorically two things. One, here we say, oh, who is the best? Who is the head? No. It is the question, who is going to deliver? The young doctors are more efficient. I am not trying to say old or not. I am myself old, but I don't say old or not good. But don't eliminate the young doctors. There you don't have a choice. Whoever comes, you have to get treated because there is a standard SOP, standard procedures, and there is a protocol which is followed. He said, those days Clinton was the president of US, he said, don't worry if Mr. President Clinton comes here or your son comes here, we will give him exactly the same treatment. That gave me satisfaction from my own experience that look, here is one place, every life matters. This is what we have to understand. Every life matters, poor or rich, or an officer, or an ordinary man on the road. Everybody's life is important. Everybody has got a wife, everybody has got a father, everybody has got a son, a brother, a mother, and they all love each other. Don't think only the rich do, probably they don't do as much as the poor people do love each other. And we just don't care about them. Here comes something which I want to talk about, women's health, particularly in rural areas, hygiene, sanitation, taboo topics, dearth of non-availability of basic healthcare facilities. Since I have traveled all over the country for my political activities, I don't think there is a single district which I have not visited in the country. From my experience of 40-45 years, I can tell you, either in the rural health system, doctor is not appointed, or the doctor doesn't come. And in any case for women, if the lady doctor is not available, it's very difficult for her to accept a male doctor, and then we don't know how he is going to behave. So it is our responsibility, the government's responsibility. When we have got a health system or a hospital or a small clinic in a district or in a block or in a village, the building doesn't make the clinic. It is the doctor who makes the clinic. It is the bounden duty of the government or whoever makes that clinic that the doctor should be provided first. Even if he is in a jhopadi, it doesn't make any difference. But a lady doctor and a male doctor is a must to be available. I want to tell my government officer friends, any increase in allocation of funds for the healthcare, 1% increase will increase the life expectancy. It will increase GDP by 6% and per capita income by 5%. So don't think we are investing in a non-productive system. Don't think health is non-productive. Health is most productive. Building roads is good. Building other infrastructure is good. But this infrastructure gives return to the society maximum. Even more than the education. If you are not healthy, what is the use of the education? Sir, this is good data for our friends in the government to find out a way how to increase the healthcare allocations. Now, for example, anti-tobacco campaign. I really don't know. I really don't know. Why are we so careless about our own health? Polio has been handled, but not tobacco. One single item which creates the maximum health hazards, and we are not able to handle it. Some countries in the world now, I find for the last 10-15 years, earlier young people will smoke and think that's their style. Now if you smoke next to me, you will be ashamed, not me. You are not wanted anymore. Some countries, I think, Norway, who have decided in next 5 years, it will become a no tobacco country in the world. If Norway can do it, why India can't do it? I am concerned with my country. Don't think it is not possible. But have we started? Have we taken one step on this area? I don't think we have taken any step to think that tobacco should be completely banned. Not only smoking, masala, pan masalas. They should be, punishment should be so strong that it is, people can know that this cannot be used. Why can't we do that? I find, I've told Mr. Gadkari that I met him about a couple of months ago in general discussions, a good person. It's good to develop highways, but do we have enough footpaths? I find in some countries, footpath is wider than the road. Because walking is a very important thing in life. I find from my home to the metro station is about 700 meters or 700 yards, something like that. All my staff will like to use the car to go there. I go on telling them with folded hands, let it take time, please walk down to that place, and they think it is insulting for us to go walking. That is one problem, and the second problem is there is no place to walk. I myself want to walk, but there is no place to walk. How do I blame them? Cycling. These, at least the elite class, we can do that. And there was a good joke going on that a man in the Mercedes goes to the gym to cycle. Why do you have to go to the gym to cycle? We should have a separate possibility on the road. A thought for today. How it is our bounden duty and obligation of the civil society to ensure that medical professionals are not unnecessarily harassed or humiliated. I don't believe, I'm not talking about one individual. Government has recently brought this law also, that new criminal code gives medical practice and lighter punishment for acts of negligence. Of course, negligence is a separate issue. This may require a relook whether it is correct or not. lighter penalty for negligence in clause 106 of BNS. Death caused by a rash or negligent act can lead to a jail term of up to 5 years. Also fine. However, in the case of medical negligence, the count of punishment has been diluted to 2 years. I mean, negligence is a separate issue. But it is harrowing that some patient dies and people start attacking the doctors. It's a roadside thing. 2 cars are accidented, so we have a road race. Why should we have a road race in the hospitals? This must stop. Must stop completely. No doctor should be attacked, either in the hospital or in the clinic. Again, this education has to be given when they are to the newly born children at home by the parents and then by the school teachers. I will speak a few words from my own experience for especially able people, specifically epileptic seizures. I will request my officers from the government to understand they live like vegetables. Their parents want to help them, but they can't get an Aadhaar card, they can't get a voter ID, they can't get any kind of ID, they can't open a bank account, they can't get any insurance, no medical aid, no disability certificate. There is one doctor in entire West Bengal, because this disability certificate is given by the central government, one doctor, and he stays on the 3rd floor of the building. How do you expect these epileptic seizure patients to go on the 3rd floor to get this certificate? No support from local or central government, can't create any trust for helping them. Medicines are very costly, poor can't afford it. Recently I read in the newspaper about DMD. I don't know, I can't even speak properly. Duchenne muscular dystrophy. I don't know, there must be some very difficult disease, suffering from a rare disease. Either we allow euthanasia, I am very blunt about it. Why do you want to leave them and suffer if you can't give them enough medicines? I think Haryana, I read yesterday only in the newspaper, Haryana has brought some ideas, some committee, and I will request the government officers to find out how do we help these people whose parents are willing to spend money, even then they can't get Aadhaar card and all that. Please see if something can be done by all of us to help these unfortunate children for whom they are not responsible. This has just happened by birth. In 2020, Human Development Report said that India ranked 156 in bed availability with 5 beds and 8.6 doctors per 10,000 people. This is only a statistics which I want to give you. Mental health we have already discussed. Sanjeevani, all of you understand already what is the conclusion. I have already mentioned India have got their own problem, but despite that allocation of more resources to begin with, that's the first step required by the government, and more facilities to the new hospitals which they want to come up, more facilities for new equipments to come up. At least a small thing, I don't know if what is the import duty on the medical equipments. That may be waived. There are a lot of things which can be done for medical health without much of the stress on their own resources. Preventive healthcare, as we talk about walking and cycling. Insurance. We still don't have proper insurance system here, Medicare. Without elaborating on that, there must be some officer from the insurance. Please look into it. How do you make it cashless? How do you make it more effective for the poor people who really can't afford it? ESI is one, but there are, in ESI I don't think more than 3 or 4% people are covered. 96%. Out of this, more than 50% people are below the poverty line. For them, what kind of insurance we can offer that they can have their lives better or more secure from the medical point of view? Medicine is a subject which is very vast subject. We can speak for hours and hours. I won't take a long time. As it is, I don't know, all of you might be hungry and not had your lunches. But maybe it is healthy not to have lunch. Just, by the way, I want to tell you, I am way past, I've just completed my 83 years on 11th of December. And I still work not 20 hours, which I have been doing till about 5 years or 10 years before, but I still work at least 10, 12 hours a day. And I have no idea when I am going to retire, if at all. Because I don't find why I should retire at all. Why should I not convey my messages of my experience? And why should I not continue to work for the society? And one of the things which doctors may not like, because I am not their patient. I can't be their patient. Till now, I want to tell everybody present here, I never had any operation in my life. Even till today, I take only 2 medicines every day. One is for my blood pressure, which in the parliament I think the pressure went up and up and up, and I had to take blood pressure medicines, which I never knew what it is, but I'm taking. I'm Logard of 5, something very small. And one for, at this age you always have some kind of urine problem, etc. So one Urimax or something, 5. That's the only medicine I'm taking. And this I'm telling you from my personal experience. I'm not praising myself. I'm telling you, if you want to become 90-year-old or 100-year-old, you can see an example standing before you who is 83 plus and who is willing to run about. I've just come here, I'm just telling you I'm going to Jaipur now, and I've got 3 commitments tonight itself in Jaipur, and tomorrow I've got 7 commitments, and then day after I'm coming back. So there is no stopping. Why? I never had alcohol in my life. I never had cigarette in my life. I never had tea or coffee in my life. Though my family owns tea gardens in Assam for the last 60 years, but I never had tasted even tea. Never had pan or supari. And being in business, you have to join people for alcohol, but I am telling you, it is not necessary. All over the world I have traveled, nobody has ever insisted that if you don't take alcohol, I won't talk to you. Nobody has told me. Nobody has told me if you don't take alcohol, you are not the right person to be associated with. Why do you need alcohol or the cigarettes for that? So, that's why I said, lunch, if you have avoided, it is good for your health, because I take my breakfast in the morning, only fruits, but plenty of fruits, plenty of dry fruits. So many other things, I won't go into those personal matters. But then I take my dinner only at 7:30 in the evening, nothing during the day. And I find it's alright. The lifestyle you can change to your convenience. Sir, ladies and gentlemen, thank you for listening to me for such a long period. I am once more sorry for coming late. All of you are always welcome to call me, meet me, if I can be of any help, assistance. My phone rings 24 hours. I am available around the clock. Thank you very much.